Hi everyone, my name is Anna Cheng. I'm a contemporary artist.
Hi, my name is Wan Qing, and I'm a medical oncologist at National University Hospital.
My name is Kabin, my surname is Lim. I'm now 67 years old and I'm associate professor in the University of Singapore.
My name is Timothy. I'm a consultant radiation oncologist with the National University Cancer Institute, Singapore.
Hello, my name is Joshua. I'm a consultant with otolaryngology, head and neck surgery.
Yeah, my name is Dave Chow. I'm 56 this year. My occupation is a logistics and document control manager. I was diagnosed with nasopharyngeal cancer, a very long name. In short, it's NPC, back in August 2002.
I was a smoker for 50 years, so I had to do cleaning and descaling on my teeth regularly. And during one of these visits to the dentist, she told me that there was a growth under my tongue. And immediately she recommended me to see a surgical oncologist and who did a biopsy and also a MRI on the growth. And unfortunately, they found it to be invasive or cancerous.
I was a full-time caregiver to my husband Henry Cheng when he was going through his treatment in NUH. Today he's now 4 years into his remission as a NPC stage 4A warrior. In September 2015, Henry felt an unusual sensation in his left cheek. Since Henry was always very healthy and he had no family history of cancer, we were very surprised when the ENT specialist found a large tumor behind his nose. And 1 week later, the ENT specialist announced the unfortunate news that Henry is suffering from nasopharyngeal cancer.
The treatment I went through was radiotherapy, or in short we call RT. Those days, the RT treatment was more or less a full blast to your tumor position. And there wasn't a 3D imaging effect to see where exactly your tumor is. So it's full strength, target at the tumor, but of course, it's not localized because of lack of 3D imaging. So there are a lot of side effects. And I also signed on for a trial, which is twice a day radiation in the last 3 weeks of the 6-week treatment. Once in the morning and once in the afternoon.
So my first reaction after this was, I was scared because, as you know, I teach in the university. Cutting part of my tongue away means I asked myself whether I'll be able to speak again. Okay? And he told me no, but I think maybe he's trying to calm my nerve.
During the initial treatment, the consultant told Henry that due to the size of his 4 cm tumor, he is suffering from stage 4 NPC. Fortunately, a friend of ours actually made an appointment for us to have a second opinion to see Prof. Loh. Prof. Loh is a very unassuming and very friendly doctor. He advised us that actually we should not predict the size of the tumor because it is actually not a flat blob or a lesion. It is 3D. He told us what is more critical for us is for us to actually know whether he could treat Henry, whether the cancer is treatable. And he actually told us that he is able to treat Henry. I mean, he was able to treat Henry, barring no other major health issues. On March 30th, Prof. Loh announced the good news that the cancer did not spread to the other parts of his body. except for the base of the brain as posited by him. But again, he reassured us that there were patients who have similar conditions that actually survived the remission for more than 3 to 5 years. That same day, we met up with the medical oncologist, another very reassuring, kind and helpful doctor. He told us that because of the size of the tumor, he would administer 3 cycles of chemotherapy comprising of 9 infusions. And thereafter, it will be followed by another 7 rounds of chemo and 33 sessions of radiotherapy. He also offered us a choice of clinical trial. Henry took up the offer because he felt that at his age, it is good that he will be able to help future patients. The trial drug was specially tailored to Henry according to his physical makeup, like height and weight. Before each treatment, actually Henry had to see Prof. Low for biopsy and endoscopy to check on his response to the drug. After the 9 weeks of chemotherapy, Henry had to go through another MRI so that the oncologist could tailor a soft shell mask and also for the IRT calibration. Thank God, the MRI showed no trace of the tumor. Nonetheless, just to play safe, Henry went through the complete treatment as prescribed.
So after the radiation, right, the salivary gland are dead permanently, the left and right gland. I only have a small gland beneath my tongue. So I got about 10%, 20% saliva. So most of the time my mouth is very dry. So I had to drink water or I use the gel. And the gel is to protect the teeth because after radiation, especially those days, it's maximum strength. So the teeth texture has also changed a lot. So the teeth now get decay faster than before. Yeah, so have to be really protect the teeth. So that's 2 side effects. The third side effect is the taste-wise, right, has gone down about 20%. So when I taste something very salty, actually to a normal person is a normal, right? So the taste has gone down. The hearing also has gone down. So sometimes when I talk, I cannot hear myself, I raise my voice. When I raise my voice, my wife will say, "Why are you shouting?" Even until today, he complained that, "Why are you shouting?" But actually, it's like, I can't hear myself, so I need to raise my voice. So the hearing is affected, and also the smell is affected. Because the radiation is this area, right? So everything this area, the cells are like dead, and some of the cells cannot be recovered. Even they can recover, it's not fully functioning. So that's why. Okay, then the next thing is a lot of mucus. 18 years, even until today, right? If I go to the toilet sometimes, it's not because I need to let go, but I need to let go here because a lot of mucus here. So that's the reason, right? But and the mucus over the years is sometimes get thickened, very thick, and it has color also. Even though I feel good, I'm not affected, or I'm not falling sick, but I have color in my mucus, right? So these are all the bad cells inside the sinus area, right? And there's no recovery on this side effect. You just have to live with it. Okay, the other thing is the pain in my neck. I think this part is because of the nerve got hit. So when I see the doctor will say, yeah, this part and parcel of the side effect. So especially when I exercise and I'm really tired in the night, then I feel a sharp pain here, then I just lie down and let it rest. And the next morning I'm okay. So just live with it. Then the other thing on my nerve is, if you notice, my mouth is like this, sunken in. My wife always very jealous of me. Hey, why is your face like that? Because the radiation hit the nerve here. So this muscle here is shrunken. And also you notice my neck also like this, sunken in. So all these are never I can't put on weight here. That's the reason, and you will get worse. Yeah. So just live every day happily and don't think so much. Yeah. Then, okay, there are more side effects. I feel tired more than before now. One of the reasons is because there's this gland beneath the brain. It was also hit by the ray. So that has changed. So I feel tired more easily. And also due to my thyroid also got affected. So I now take the thyroxine because there's this hormone in my body that's very high. Because the thyroxine is not functioning well. So I need to take this for throughout my life. So that helps me to manage my tiredness and also cold. So in the normal room temperature, 23, 24 degrees, I feel colder than before. Yeah. So these are the hormonal change in my body that is affected by the radiotherapy treatment. The other important side effect is the mouth and the neck muscle. Over time, because of the radiation, especially so long ago, was maximum strength, the muscle will harden.
Some of them become long-term, and some of them are still with me. For example, dry mouth, and I have to learn how to speak. Okay, and that's why I have to carry the moisturizer everywhere I go to lubricate my mouth every time when I'm unable to articulate properly, and also the stiff neck. I'm basically a teacher, so out of the 3 inconvenience, 2 of them affect me deeply. The ability to speak clearly with extra effort, and secondly, the dry mouth. Another very big inconvenience is, you might not know, I will sometimes just lose my voice. My mouth is moving, but nothing comes from my throat. And these are the effect of this operation. These are basically the adjustments I have to make. And of course, a lot of rest. I knew that at that time I couldn't talk. So the first thing I did at that time was, because of the nature of my work, I had to speak clearly for long hours. And the first thing I did after I was discharged from the hospital was to attend very regularly the session with a speech therapist, so that I can learn how to speak, or relearn how to speak fast because of my work. And during this learning, it was very interesting. Then I found that when I started to learn that we can never speak clearly with our tongue outside our teeth. If you don't believe, try it. Okay? And I also have to learn how, so when I talk, I have to suck in my tongue behind my teeth. And secondly, I must know how to direct the tongue at the right position in the mouth and to curve in a certain curvature to speak clearly. So these are the long side effects. I'm still doing this. Okay, so I suppose that after this cancer operation, I told myself anyway, I will not be the same. Okay, so I have to change to adapt to this new situation. I have to apply the moisturizing gel in my mouth before I speak, because that is supposed to last for 7 hours. And in between, whenever I speak and I get the dry throat, I have to spray moisturizing gel. And in between time, I drink a lot of water to lubricate my mouth. Because trust me, if you after you relearn the new way of speaking with effort, your mouth gets dry faster.
So just now I took some time to apply the gel, the oral gel. Okay, this oral gel mimics our saliva. It moistens the mouth as well as protect the teeth. So this exercise of the face and neck is very important, which I do twice a day. I also recorded a video in the YouTube, and now this video is shared everywhere, just to educate people that it's important to exercise your mouth and neck muscle so that it will not harden over time. Once it hardens over time, you cannot open your mouth, and it's irreversible. Right? And then once your neck muscle hardens over time, you cannot turn your neck. So this set of exercise is very important, and And especially new patient, you have to do it and do it every day, at least twice a day for 5-10 minutes.
It came as a shock to us. We actually could not believe that, but it just came as though that, we just heard a very cruel verdict that Henry is a verdict of a life sentence for Henry. It wasn't easy for me as a caregiver as well. Apart from the juicing and all that, it was a real strain on me physically, and psychologically it affected me just as badly. At that time, my sole refuge was on God. I depended and rested in Him. And I would pour my sorrows and fears to Him in silent tears. From the day of the diagnosis, for 9 months, actually, I was frantically researching and reading up on how I can help Henry brave out the treatment. Actually, every day his breakfast is 4 mugs of vegetable juices and 1 mug of fruit juice. And thereafter, he will have his breakfast of a bowl of oats, an hour after the juices. And his meals are usually very healthy meals that I home cook myself. They are usually more of the softer diet on fish, meat, vegetables, and concoction of soup that I prepare for him. And in between the day, I also had to prepare fluids like green bean water, coconut water, as well as the soursop leaves water that I boil for him. Actually, in total, Henry will consume about 2.5 to 3 liters of fluids a day. On days of his chemo sessions, I will send Henry to the hospital and then rush back to prepare his juices and also cook a light lunch for him. And then I will hurry back to the hospital again. Personally, I feel that the juices have helped Henry to shield him from the onslaught of the 33 rounds of radiation. Because apart from 2 ulcers and the loss of saliva towards the end of the week, Henry was very well, and in fact, he was playing tennis like 5 times a week throughout his treatment until the last week of his treatment. To prepare Henry for the radiation, I make sure Henry applied the 100% aloe vera gel, the moisturizing and healing cream, as well as the vitamin E oil. This definitely helped Henry because even after the treatment, there were no signs of the, Henry's neck was neither black or red, and he was still feeling very well. Although physically, Henry appeared to have avoided most of the adverse side effects.
As I said earlier, the acceptance is important. Once you accepted it, then you have to tell yourself, how do I transform myself to like another individual, right? As I mentioned earlier, my first life was lived in a certain way. Now I recover and have a chance to live a second life. Shouldn't I live the second life better than the first? The answer is yes. So because of that, I had to transform the mindset. So with your positive mindset and changing from lifestyle to diet to having more exercises, right? Eating healthier food and manage your stress, right? And telling yourself, always be happy, no worry, So with this kind of mindset and right attitude moving forward, it's easier to manage the side effect, right? Because we have to understand the side effect will not go away, all right? And because it never go away, so the more you have to ensure that for the long-term survivability and betterment for the future, you have to transform yourself, right? So what I do every day is just be happy and try to let go whatever baggage I have in my mind, right? And of course, I take a very healthy breakfast. My breakfast is what I call the Dave Super Breakfast. Sweet potato, carrot, and tomato. Just steam and eat, right? And the sweet potato takes the skin because the skin has very high fiber content. And why sweet potato is good? Because sweet potato, tomato, and carrot, all these are very high antioxidant, right? All these are natural nutrients to ensure that immune system can be maintained at the highest, right? So with the right attitude and be happy, your immune system will always be there to help yourself to fight on this cancer, to ensure that the relapse will never come back, right? So besides the mindset and changing your lifestyle, it's about learning from other people. That's why joining the support group is very important. Because support group, like I'm 18 years old, there are people 26 years old, right? 8 years old ahead of me. So I learn from him on how to cope. Of course, everybody's management of side effect can be different, but some of these generally are quite similar. Like if I have dry mouth, I use the oral gel, right? Joining through a support group not only help you psychologically, emotionally, it also helps you economically, right? So it's a lot of advantage to join a support group because you can learn from each other, right? And then we encourage each other, motivate each other to move the journey together. Hand in hand, you're never alone.
Yes, definitely. The technology has advanced so much that nowadays treatment is very targeted. There's 3D imaging. They know exactly where the tumor is, so they will whack the tumor when they see the tumor, I mean the machine. Otherwise they will hold back. It's like Tai Chi like that. So that's why today the side effect is much lesser than my time, 18 years back, 20 years back. So I'm very happy to see that, yeah. But when I share the journey with them, I always tell them that you have to assume the worst because because the side effect to everyone is different because our body is different. So our body, the way we react to a side effect is different.
I'd like to thank Mr. Dave for sharing his story with us. He has been a nasopharyngeal cancer survivor for 18 years. While nasopharyngeal cancer generally responds well to treatment such as chemotherapy and radiotherapy, the main reason for his excellent prognosis was that it was diagnosed at an early stage, and he went on to complete his treatment. As a Chinese saying goes, 病从浅中医, which means that it's always best to treat a disease when it's in an early stage. It's important that we do not ignore symptoms of nasopharyngeal cancer, such as a neck lump, which is often painless, blocked nose, nosebleed, hearing impairment, or ringing in the ear. If someone you know have such symptoms, you should advise him or her to seek medical consult early. Mr. Dave has also shared with us the long-term side effects that he received from his treatment. Firstly, he has dry mouth, which is probably the most common side effect among patients who had received radiotherapy. But like what he shared as well, this can be easily managed with diet modification, frequent water intake, and the use of moisturizing mouthwash or mouth gel. Secondly, over time, the skin and muscle around the neck and the mouth would tighten and cause neck stiffness and difficulty in swallowing. This side effect cannot be prevented, but it can be easily mitigated with stretching, swallowing exercises, and diet modification. Thirdly, he has hearing difficulty, which can even worsen over time. The ENT, or ear, nose, and throat doctor, will help to assess the cause of the hearing impairment and recommend the most suitable treatment. This treatment may be in the form of a small operation to insert a tiny tube into the ear to drain fluid, or maybe a hearing aid to increase the volume of sound. With improvement in technology, there are now applications that can be downloaded on handphones to help people with hearing difficulty. Fourthly, he has low thyroid hormone, and sometimes patients may have inadequate production of other hormones as well. This is because the glands that produce these hormones are located in the head and neck region, and were hence affected by radiotherapy. Your doctor will monitor your thyroid hormone level on subsequent checkups, and if found to be insufficient, they're prescribed medications to replace it. Lastly, a less common side effect is osteoarthritis necrosis, or bone death of the lower jaw, which may lead to pain or infection. It can be prevented by maintaining good dental hygiene, and patients are recommended to go for a dental review on a regular basis, 6 monthly at least. The good news is now with technological advances over the years, we now have better radiotherapy techniques, such as intensity modulated radiation therapy, or IMRT for short. It delivers precise radiation doses to the cancer, minimizing the dose to the surrounding healthy structures. This causes fewer side effects as compared to the conventional radiotherapy technique. We acknowledge that battling cancer is not an easy feat, but with a positive mindset and support from the doctors, family and friends, and even support group, you will be able to overcome cancer and the treatment side effects, just like what Mr. Dave did.
To get NUH pay for my medical expenses, I got to let my boss know. Now, but seriously, to go back to work or not, the most important thing the university asked me is only if I'm able to speak clearly for a length of time and able to interact with the student, then I'll be allowed to go back to work. Other than that, if I cannot speak properly, I will have to concentrate my work only on research activities, no teaching. But I think NUS has been very nice to me to give me this kind of flexibility. But this I can only speak from my point of view because it depends a lot on the kind of cancer that a person gets. Now for me, and if you ask me can I go back to work meaningfully, is it? Yeah, I think it's yes. For me, it's yes because it is more of my characters. I think we should always fight our way to meet a new challenge. However, due to the multiple change, we have to have a very good mindset. As I am not going to be the same limb carbine I was before. So the key to go back to work is a keyword adaptation. The adaptation is very important to adapt to a new limb carbine, but not the old one anymore. Okay. Now, jokingly, I can tell you that I love singing, but now I can't sing. Okay. Okay. Second thing is, now the other mindset we must have is, personally, I hate when I'm in the situation of unknown. So to me, I want to be always in the know. Why? Why is it so? I'll tell you later. But after having these cancer problems, I start to find out the medical basis of this. Why I get this? Wow, smoking for me. Why I get this, and what causes this, and what kind of treatment, what kind of changes in life, and all this. I found out everything because all these factors, when you put them together in a meaningful, cohesive whole, it will help me to set up a plan which will facilitate my adaptation to a new life of me. But lastly, I think the more I share with people, the more I feel that cancer doesn't affect me anymore. And I think in a self-help group that I'm in, it's a very useful thing to have, because from there we to be advised, and also we share resources. We seldom share sorrow, but we share the feeling. And I think human beings, other than material part of us, the moral part is very important, because people with high spirit will fight the disease better. And last message I have to you and the comment is, if you are a smoker, stop smoking. I was a smoker, and please don't go into the same thing that I had to go through so painfully before. Thank you.
Nasopharyngeal carcinoma, the most common type of head and neck cancer seen locally, commonly affects patients in their 40s to 60s. Many of them were still working prior to their cancer diagnosis, and after cancer treatment will go into remission. They have many productive years ahead of them to contribute to society. Other types of head and neck cancer tends to affect older people, commonly in their 60s or 70s. Some of them may already be retired or close to retirement. For them, the goal of treatment is to get the cancer under control so that they can return to life with their social groups and family. Head and neck cancers occur in a region of the body that affects important functions like eating, talking, breathing, and hearing. Patients who have cancer of the tongue or voice box, we call that the larynx, may have speech affected by the disease or its treatment. Some may be mildly affected, requiring a short period of adjustment before making a good recovery. Others may need a longer period of voice rehabilitation. Cancers affecting the throat may affect swallowing. Most patients may need to adjust the diet temporarily to softer diets. Some may need a temporary feeding tube, but most patients will return to some form of oral feeding eventually. Hearing can sometimes be affected by treatment, either radiotherapy for nasopharyngeal carcinoma or chemotherapy for other head and neck cancers. Most will be mild, and people around may not be aware. Perhaps the patient may miss a few words from time to time, but is perceptible to the patient. They may be able to compensate by straining or focusing hard to hear, especially in a noisy environment. Only a minority of patients will have significant hearing loss for which hearing aids are required. Cancer treatments can be taxing on the body, and cancer survivors will need a period of rest after completion of treatment for recovery. This period may differ between patients depending on their physical condition and the type of treatment they received. How ready they are to return to work may be dependent on the nature of their work. Doctors will assess patients regularly and give advice, and sometimes MC or memos to employers for this reason. I hope employers can extend kindness and understanding to some of these patients who may take a longer time for recovery, and eventually, many will return and contribute to the company. Some patients may have specific issues that can be overcome with simple adjustments at the workplace. For instance, I had a patient who is a telephone receptionist. After NPC treatment, her hearing was mildly affected, such that she struggled to hear telephone conversations because of the ambient noise. Employers provided headphones in place of the normal headsets for her, and she is now able to carry out her duties as before. When cancer survivors return to work, they may be very conscious of how their colleagues perceive them. This may be due to concerns about productivity at work or their social interactions. Some patients may eat out less due to medical reasons. Others may be consciously adopting a healthier diet. This does not mean that they are less sociable. Most cancer patients still want to connect with colleagues, just like others at the workplace. My message to employers is this: head and neck cancer patients can still meaningfully contribute to the workplace after treatment. Please do not write them off. However, do understand that they may take time to recover and they need adjustments at work. Many will continue to be productive for years to come.
I have always been pretty health conscious, but now I made a very mindful effort to cook more regularly at home, and also still monitoring Henry's health and diet. His breakfast is now still a bowl of oats, but with organic powder from green powders from vegetables as well as spices. Cured meat and deep fried food is now a no-no. The deep fried food will be occasionally replaced by lightly pan-fried or grilled food. Now we are also making a conscious effort to exercise. My perspective in life has changed dramatically as well. I realize even though we can take good care of our health, but there's still an unknown that is unpredictable, and unchangeable by us. Now, I value every minute that I spend with my family and friends. I try to change myself for the better. I try not to judge others. And I'm very, very thankful for the One Heart support group throughout Henry's treatment. From them, I learned a lot, like how to take care of Henry and so forth. And because of their gracious help, now I try to reach out to others. Today I'm also more prayerful, and I'm really thankful for God. We've always been on my side. Yes, I might not be able to script my expiry date, but I certainly can alter my life destiny.
Thank you, Anna, for that very meaningful sharing. It's really tremendously heartwarming all that you have done for Henry, how you shared in the emotions, the ups and downs of his journey. You know, the love that you have showed him really speaks of your commitment to your marriage and to your family. At this point, I really want to acknowledge all the caregivers, family and friends of cancer patients that are listening in. Each of you play a tremendously important role in the physical and emotional recovery process of a head and neck cancer patient. So as you know, the head and neck is a really compact and complex region, and that also means that the range of side effects from treatment can be very broad. During the course of treatment, there can be dryness of mouth, pain and difficulty swallowing, and very often this requires some kind of adjustment in diet, whether it's taking foods with a softer consistency or even taking smaller and more frequent meals. And of course, very importantly, keeping well hydrated. All of these may sound like very simple adjustments, but many of you know when it comes down to the nitty-gritty details, to marketing, to deciding on the ingredients and the preparation of food, it no longer becomes trivial, right? Sometimes it may mean preparing 2 separate sets of meals for the family, lifestyle changes, and really many sacrifices from caregivers. In some cases, the treatment process may involve inserting a feeding tube or a tracheostomy tube into the neck of the patient to help with breathing. In these situations, actually the role of a caregiver becomes even more critical, because many times the caregiver can be the first person to detect a problem with the tube, or even the first person to realize that the patient is unwell. As a doctor, in my practice, it's always very heartwarming to see a cancer patient come in with his family or his loved ones. I really love that. For me, it's a great opportunity to get everyone onto the same page, to be able to explain the diagnosis, look at the scans together, and also explain the current situation and what the treatment options are. I think being all together in the same room really helps to unite the family towards a common understanding and goals for treatment. I've seen patients come in pre-treatment, smiling, full of optimism and hope. And very often in the middle of treatment, sometimes you don't see those big smiles anymore. But instead it's being replaced by a sense of perseverance, like trudging on in the middle of a marathon. Yet it's during those same moments where I see really special moments like elderly couples holding hands. I see children with their arms around the shoulders of their parents, just pressing on and pushing forward. As Anna has shared, this journey is not only a journey for the cancer patient. As caregivers, family and loved ones, you are also going through your own journey, and it's not an easy one. We'll all have our moments of doubt and fatigue, but surely there will also be moments of hope, peace, and strength. I think it's really important for all of us to draw strength from those moments, whether it's through your faith in God or through spending time with loved ones who can encourage you. Just as the cancer patient leans into you as a pillar of support, you too need to lean in to someone as a source of strength. So thank you very much for all that you do.